We are going to have one more short presentation. It's by Dr. Arash Hakhamian. He's working with Shiva Kumar and a group of young people, and he has his presentation is entitled Uberism in Dentistry, basically. It's an interesting concept, and I'm so glad that they are here so they can present it. Arash Hakhamian.
Dr. Nozari. Thank you guys for having us. Today, I want to talk to you about Dentulu. It's a company we started which provides dentistry on demand. So first of all, if you're not aware or haven't heard of Uber, ironically, actually, we're talking about Uberization, and today is the day that Uber is going public. Today is their IPO. But Uber basically revolutionized the way the taxi service has worked around the world, and they are bringing in roughly around $50 billion in annual booking revenue under their services. And that includes the Uber Eats, Uber Rides, and other services they provide. Now, Uberization, the concept of Uberization, works by providing a direct connection between the actual consumer and the end company. So that's through the use of mobile technology, on-demand care, and we really have kind of describe this with the 4 C's. They provide control, so the customer now has control over how they receive and seek those services. And the convenience aspect, and also the customer experience and the connection using on-demand mobile services. So this concept and these particular characteristics have now been applied to various different companies and different verticals. So now massages are available to come to your house. You can have doctors come to your house. You can have mechanics. You can have food delivered. So there's a whole number of verticals that have increased the convenience and access by using this technology and by incorporating these characteristics. So I don't want to go too much into the statistics of the epidemics of dental caries and gum disease, but currently, over 50% of Americans have some form of gum disease. 33% of Americans have untreated tooth decay. And unfortunately, these statistics get really worse with the geriatric community and the handicapped and disabled community. So that's something that we have really tried to tackle with Dentulu and the services that we provide. Now, I've personally been doing mobile dentistry for over 10 years. We created suitcases that can pretty much take all the equipment that we need to provide preventative care, even fillings, extractions. I've even done surgery in the Saudi Arabia Royal Home. But we've also utilized this in third world countries where we're able to actually take the dental office to remote locations. As a response to these startling statistics, the ADA actually presented a bill to Congress, which now recently passed into law in December of 2018. And as a result, the services that Dentulu provides and the Uberization of medical and dental care are now backed by actual legislation and also are supported by insurance companies, which now actually have created codes. So what is Dentulu? So what we've done here is we've basically shrunk the entire dental office into a small, easily carryable, luggage-sized box where we can not only do fillings, cleanings, extractions, whitening, but a myriad of other procedures as well. We also have mobile x-ray units and intraoral cameras which allow us to actually see inside the patient's mouth from anywhere around the world. And this technology is backed by our mobile software, which includes applications for clinicians, for the patients, and our ERP system on the web. So this means that we can literally bring the office to your home and even get dental cleanings poolside. We have over 100 years of dental experience on our team with an in-house team of actual technologists and software developers in India. And we are also backed by Google and working directly with Google on improving our software and on bringing this technology around the world. And we have multiple other partners that we're working with. So just want to tell you some different applications of how this could be utilized and is currently being utilized. So over 164 million work hours are lost every single year just traveling to the dentist and actually getting your services and traveling back. Imagine a lawyer who's getting paid $500 to $800 an hour. Traveling to the dental office for a simple cleaning is going to cost that lawyer over $1,500, not including the actual procedure. Or after an implant placed by Dr. Nozari, the patient has to come back and actually do a post-op check. This is going to be an expensive trip, just traveling to the dentist and coming back for a quick 10-minute consult. And so what we're able to do now is actually pop up these mini dental offices in office buildings, in factories, and even in small businesses, and allow preventative care and actual dental work to be done inside the office, in a small boardroom or inside a very small room where we're able to provide cleanings, whitenings, x-rays, and exams. We're also able to teleconference with a dentist from those locations using our intraoral cameras. So everything is sent between the actual location and the dental office through an encrypted network where a dentist can actually see everything that you can see right there and actually diagnose, give advice, and basically recommend the type of treatment that he or she feels is necessary. And we've been able to reduce that travel time to about 45 minutes, which is just basically for the procedure. Let's talk about children. Every single year, over 51 million missed school hours by children due to dental-related pain. So through our mobile services, we're actually able to leave an intraoral camera with the nurse. And anytime there's an issue, that nurse can immediately now connect to a dentist or a dental professional who can help alleviate some of the questions, concerns, and facilitate that process. Now, mind you, if 51 million school hours are being missed, that also takes up the parents' time having to pick up that child and take them to and back from the dental office. We also provide pop-ups at actual schools where basically the kids would come and leave their classroom in order for about 10 to 15 minutes, get preventative care like fluorides, sealants, and cleanings, and allow a lot of this preventative work to be done before they end up with pain. Let's talk about disabled. So one of the biggest issues, imagine you are a disabled person who wants to go to the dentist. You would have to make your appointment and schedule transportation a week in advance with a 4-hour window of waiting for that truck to come and pick you up, take you to the dental office, and God forbid your dental appointment runs a little bit over. Now imagine the logistics of having a car come and pick you up and take you all the way back home. We can prevent all this by simply scheduling an appointment on our app, which allows the dentist to come to your home or to whatever facility and perform these services there. And we can also leave a intraoral camera at that facility so any post-op concerns, questions can immediately be addressed by connecting to a dentist within 5 minutes. In addition to that, most offices, I've owned many dental offices in my lifetime. One of the biggest concerns I had was getting sued, right? A lot of offices are just not equipped and have not been renovated to deal with ADA compliance issues. And actually, California has the highest rate of ADA lawsuits in the entire nation. So we can also apply this concept to the elderly, whether it's at a skilled center, a hospice, senior centers, or even just at home. We can now decrease that 96% risk rate for geriatric patients by leaving our intraoral cameras at these facilities and by being able to take our services to the facilities directly. And now the actual ADA codes and the CDT codes actually allow us to bill for these services as well. Let's talk about emergency rooms. 2.2 million visits to the emergency room for dental-related problems, and these were just preventable problems. So, imagine not having a dentist and you're in pain. You end up at the urgent care center, and you are not a high priority to an emergency room. It's not life-threatening, and oftentimes you're just stuck sitting there for about 3 to 4 hours until you're seen. And unfortunately, we have orthodontists at CVS now, but we don't have any dentists in emergency rooms. So what ends up happening is they leave with opioids, and we're having a huge impact on the opioid epidemic. And they're basically given pain medication and told to find a dentist. And oftentimes, those patients end up back in the emergency room to receive more opioids. And this is costing us over $1.6 billion a year. And the cost of treatment at the hospital is 3 times what it would be if taken care of by an actual dentist. So what we're doing with hospitals now is we're equipping hospitals with the basic setup: digital sensor, a Nomad, and an intraoral camera. And now the hospital is able to intake those patients and now communicate directly with the dentist, who's able to give them a correct diagnosis and also facilitate basically that patient's appointment the next day or the same day. I had this patient, this is from last week, this patient fell and her teeth were in her hands, rushed to the emergency room, and the emergency room had no idea how to deal with this, and they tried to put the teeth back in, and they actually put it in the wrong sockets. So she presented to my office with teeth in the wrong places, and we're just poorly equipped and understaffed, and unfortunately without enough experience in these emergency rooms to be able to address these kind of emergencies. Now, this is how we help hospitals and emergency rooms handle this, but we actually have the ability to immediately connect with the patient even before they go to the emergency room. We can prevent all these unnecessary visits to the emergency room if we simply address people's pain and questions and not let their worry force them into the emergency room. So a patient can now download our app and within 5 minutes connect to a dentist near them, which is all automated by our geo-tracking capabilities, where we can actually see where that patient is located and which one of our doctors is available and close to that patient. And the patient these are just examples of this last week or two, where patients were able to download the app, connect with me, get some advice. If I deemed it necessary, I would call in some pain medication, possibly antibiotics if I felt that it was appropriate to do so, and immediately make an appointment for that patient next day in the office. Now, this is also useful for a person who has a trusted dentist in their own country. Let's say you're here from Israel and you trust your dentist and you have an emergency right now. Well, you can communicate using our software with your dentist back at home. And similarly, let's say someone in Guatemala wants to consult with, Dr. Madahi in Beverly Hills. They can simply download the app and within 5 minutes have a full conversation on an encrypted network with any dentist anywhere. And since we're talking about space, this is something that could even be utilized in space. With an intraoral camera, a dentist here in Los Angeles can actually see what's going on and give advice to anyone in space having any issues. So, this model is not necessarily new, and mobile dentistry is something that is going to revolutionize our field. Unfortunately, most mobile units cost upwards of $300,000. What we've been able to do is shrink that into an investment of around $10,000 to $15,000, which is affordable even for a new dentist who just graduated, in contrast to having to open up an expensive dental office on top of their student loans. Now they can make a small investment and really be able to reach people in different areas, any one of these verticals really, and utilize our software to not only be able to store information, give immediate access to the patient's charts anywhere and any time that they want, but also be able to incorporate that with our units so that there's a comprehensive system here to address whatever needs are necessary. So I'd like to present Mr. Shiva Kumar. He is the technology advisor in India who has developed some of this software.
Thank you, Dr. Arash. So I'm here to give you an overview of how our app was developed, how our ERP was developed. Our idea was to automate the entire dental process, which Dr. Arash was explaining here. So we made a lot of thought on building this ERP and the app, and we came up with, it's completely first of its kind. There is no dental app which is exactly doing what we are doing. We have a team in India with a combined experience of 35 years, and we took nearly like 1 year and 6 months to build the entire application, put it to real-world testing for at least 5 months, and we made sure it works smoothly, it has a great user interface, and it is completely automating the service which we would like to provide to the users. It has a back office system which actually enables the entire process, the entire workflow, so that the dental team as well as the patient can easily communicate and make sure the entire workflow is streamlined. So our ERP, we are just highlighting 4 different features here. The logistics module, the scheduling module, the inventory and geo-tracking. But the entire platform is equipped with various different modules, which obviously enables us to control our appointments, our workflow, the doctor's appointments, the hygienist appointments, and if there are any inquiries or requests coming from the patients, chatting with the patients in real time if they are unable to use the app. So various other features are completely compiled into the software. We have 2 apps. One is for the patient, one is for the clinician. I would like to highlight a couple of features on the patient app. One is like they have very easy user interface, which is we have put a lot of thought into building it. We made sure like even a 15-year-old or a 60-year-old should be able to use our app. So we made a lot of thought into it. We took a lot of different examples and came up with the patient app. And here's another feature which we integrated into the app. So if the patient has made an appointment, it allows them to see when the dental team is actually coming to them, just like how the Uber car comes to pick you up. So on the day of the appointment, they can see the team coming to them. And it has got a lot of different features into tracking their appointment. We also have, as Dr. Arash was explaining, the emergency calling feature. This is one of the excellent feature we have got, which enables the patient to call the dentist in an emergency for a small fee, and then they can get an emergency consultation, and then they can be called into the office next day. We have the clinician app. The clinician app allows the doctor, the hygienist, and the dental assistants to log into the app. They have their own dashboard. They can see their appointments, and pretty much it enables them to, It pretty much enables them to communicate with the doctor, with the hygienist, like an internal communication, even through the app. So we have done quite a bit of testing on this to make sure it looks very easy, user-friendly, and it's very comprehensive. For the doctor, we made it very simple so that they can see their appointments and they can see the list of patients who they have been talking to, which allows them to give treatment plans and get consents from the patients. It's all in the app. It makes very simple, and this is one of the best features we feel we have is the patient can chat with the dentist even after the service. So this enables them to give follow-up service, as well as it increases chances of getting leads to the office. So I'm really impressed with the service because it's very simple, it's secure, it's over a secure network. They can share images, they can share pictures of X-rays, and everything is encrypted and completely HIPAA compliant. So we also thought a little bit further ahead, thought like, this system should be usable for anyone. So we came up with a web-based portal for the patient as well as for the doctor. So we made a doctor's portal where they have an easy interface, there's the calendar, and they can even chat or have a video call from the web interface if they don't want to use the phone, so that they can have a better view of the patient. And this entire system is developed over Google's native language, which is Android, and iOS native language. It's completely HIPAA compliant, and we have implemented all the different web technologies to ensure the cloud-based software is very comprehensive, secure, and we have really reduced the dependencies of the third-party APIs, which is key for any application like this, which is automating a service. So the dependencies is very low, and it's completely self-built and customized. Over to you.
Yeah, we're currently launching in Los Angeles, and we are set to expand to the rest of the state of California by the end of 2020. And this integration is not only working between dentists and dental specialists, but it's also working between dentists and medical doctors, and also direct to consumer. And we're hoping the same way Uberization has worked well for these other verticals, we hope to be in the United States and eventually around the world, and maybe one day between planets. So we're looking forward to that. Thank you so much, Dr. Nazari.
Thank you so much. Thank you, Dr.
Really
Nazari.
Thank you.